Hi everyone. Have you ever had a client come in with a recent injury and you wondered, maybe this is a sprain or maybe it's a strain? How do I know the difference? That difference is actually quite important, and it greatly affects how you're going to treat them and how you're going to be effective in your treatments with them. In the next few minutes, we'll demystify these injuries so you can provide the best treatment possible for your clients. So in this video, we're going to focus on ways to quickly differentiate between muscle strains and ligament sprains. We'll talk about some key assessment tips and principles to use in your massage practice, and then finally we'll wrap it up with some treatment suggestions and considerations to help you best address these different conditions. So stick around to sharpen your clinical skills and avoid that confusion and pitfalls when working with these different types of injury conditions. If you're new to this channel, my name is Whitney Lowe and I'm the director of the Academy of Clinical Massage. For over 3 decades, I've been focusing on how to help massage therapists learn how to treat pain and injury conditions. So let's see how we can help you as you explore these different conditions with your clients. The first place we're going to start off is with sort of definitions. What exactly is a muscle strain versus a ligament sprain? Then we'll talk about some signs and symptoms, the key methods for identifying these different types of problems, and what are the hallmarks of each condition type, including pain patterns they have, typical presentations from your client, and various assessment tests and the results from those procedures when you're doing your assessment. And then finally, we'll wrap it up with some treatment tips and some hands-on strategies that'll help you guide your treatment to be most effective with them. So let's focus on definitions first, and we'll start off with muscle strains. So essentially, a muscle strain is overstretching or tearing of muscle or tendons, technically. You just don't see very many discussions of tendon strains because the muscle is much more susceptible to the strain and tearing injury than the tendon is. Tendons are very, very strong and very resistant to tensile loads that would be sufficient to cause tearing of those fibers. Now, it certainly can occur. This occurs in a situation with something called an avulsion injury sometimes, where a tendon actually tears away from its bony attachment. But that's not a real common injury. Far more likely we see muscle strains where there's tearing or overstretching of the actual muscle belly itself. Now, commonly we see muscle strains occurring right in the musculotendinous junction. That's right where the muscle blends in with the tendon fibers. And that's mainly because there's 2 different types of fibers blending together there, so it's a structurally weak point. Typically, this will involve pain sensations, possible swelling. There may be some bruising associated with that if the capillaries have been torn as well. And there's usually going to be a reduced strength of that muscle. And so pain associated with it and the reduced strength is usually an indication of a muscle strain. Now, muscle strains are graded in 3 different grades. We have first degree or mild, which is just a minor overstretching. Second degree or moderate, which is usually a pretty significant injury, but the muscle is still intact. Or the third degree, which is considered severe or a complete rupture. In the severe or third degree strain, we've got a complete disruption of the muscle, or the vast majority of those fibers are torn. That may need surgical repair in certain types of situations. Now, ligament sprains are also graded in 3 degrees, and this is somewhat similar. A ligament sprain occurs when you have a stretching, like an overstretching, or a tearing of those ligament fibers. Remember that ligament connects bone to bone, and often there's joint instability associated with a ligament sprain because the ligament's giving additional stabilization around that joint, so you overstretch those fibers, and of course there's likely to be some degree of joint instability that comes along with it. There's oftentimes some degree of swelling. There may even be an audible or popping sensation that was heard at the time of the ligament injury. But note that can also happen with certain muscle strains as well. There is likely to be localized swelling with these ligament sprains, and also they are graded in 3 degrees just like the muscle strains are. We have first degree or mild, and this is usually just a very mild amount of overstretching of the ligament fibers, but it can usually come back to its normal resting and stabilized length. In a second degree sprain, this is considered a moderate sprain, we have an overstretching of ligament fibers, and it may cause a semi-permanent elongation of that ligament, which means it won't go back to the degree of stability that it had prior. So this is an important factor because when you're taking your history, you want to identify if somebody has had previous sprains in that same area, because that could mean the ligament is already a bit overstretched and more susceptible to injury. And then we have the third degree sprain, which is a severe or complete rupture of the ligament. This is a pretty serious injury, and there's going to be very significant joint instability, and oftentimes this might be something that would be a need for surgical repair. So let's take a deep dive look at some of the more specifics of muscle strains and ligament sprains in particular. So let's take a look at the hamstring muscles as an example first when we talk about a muscle strain. This is a muscle group that is commonly injured from muscle strains. We see them actually most common in the biceps femoris muscle here on the lateral side of the thigh. One of the most important factors when trying to identify the cause of a strain is there something in the history that would indicate a likely overstretching or overload on that muscle? Let's take a quick look at some factors associated with motion in the hamstrings that frequently cause strain injuries. Now, interestingly, in the hamstrings, we may have a strain right here in the middle of the muscle belly. But as we said earlier, frequently we see those strains occurring right here in the musculotendinous junction, so right where the muscle and tendon are blending together. And that's because a lot of very significant forces are being imparted here from the muscle into the tendon, and we have a changing fiber type, which makes this a bit more vulnerable to the strain injury. Now, when you were studying your muscles and the muscle actions, you probably remembered or were taught that the hamstrings and the biceps femoris is primarily a knee flexor. So when it's engaged in its concentric contraction, it's going to bring the knee up into flexion like this. But we see a lot of the strain injuries to the biceps and the hamstrings occurring not during that flexion activity, but also but more likely actually during the eccentric action when the the leg is straightening back out and you're decelerating forces here. This happens, for example, at the very end of the running stride. So when somebody's sprinting and they throw their leg out, so their leg is up behind them here, and they throw that leg out down here just before it hits the ground, there's that sudden slowing down or eccentric contraction of the biceps the biceps femoris muscle and the other hamstrings. And this is one of the common causes or locations of what might cause injury to the hamstrings. Now, generally, when you're palpating or identifying this, there's likely to be tenderness in the muscle belly right where the injury site is. If it's a moderately significant strain, like a second degree or third degree strain, there's likely to be what's called a palpable defect in here. So as you palpate this tissue, you may feel a little divot or indentation in that tissue, indicating that's where the tissue damage is and that's where the disruption of those fibers are. Now, as we said earlier in the signs and symptoms, when we're evaluating this, there's likely to be pain and discomfort associated with movement when you engage that contraction, and then also when you engage it in a manual resistive test, which we would do with resisted knee flexion. That's putting a load on that hamstring muscle group there, and that's likely to reproduce the pain right in that same area where the strain has occurred. So those are some of the key factors that would identify it. But again, so important is the client history. Identify any factors that would indicate the likelihood of injuring that particular tissue from what happened in the history, like a sudden overload or a sudden forceful contraction that muscle had to engage in, causing the muscle strain. Now let's talk about ligament sprains for a moment. The history is just as important when dealing with ligament sprains. If we've had a sudden load on that joint that would have put pressure or force on that ligament, that's a good indicator of a possibility of a sprain occurring. Let's take an example here. We're looking now at the back side of the leg, but let's just zoom in here just a little bit on the knee, and we'll just turn this around a little bit and see. This is a common ligament injury in the knee. This is the medial collateral or tibial collateral ligament. This is on the medial side of the knee, and its primary function is to resist an excessive force coming from the outside. So let's look at what that looks like for just a moment. So if the knee is exposed to a force from the outside coming in this direction here, that is the primary function of that medial collateral ligament, is to resist that force and keep that joint stable. So when you're taking your client history, identify if there's any sudden force that came from the outside of their knee, or maybe even something that bent their knee inward. For example, we see this commonly in skiing injuries when somebody catches an edge of their ski on the snow and then they bend their knee inward. That puts a very serious stress. It's called a valgus force on the medial collateral ligament here. So identifying that in your client history is going to be essential for determining whether or not we might have had a certain ligament exposed to those types of forces that would be sufficient to cause the sprain. Now, just as with muscle strains, ligament sprains are likely to be tender right at the site of that injury. So if we come in here and we palpate those particular ligament fibers, it's likely to be quite tender, especially at the site of where that injury is. So knowing your anatomy of where these ligaments are located is going to be very crucial for identifying whether or not we have a sprain or damage to that particular ligament. Because do keep in mind, there's also likely to be muscle tissues overlying this area. For example, here on the medial side of the knee, you've got tissues that are coming in from the adductors that are also over on the medial side of the knee, and a number of other things that might be in that same general area. So we want to make sure we identify, is that actually a ligament that's injured, or is it something like other tissues that are overlying that? And that's what's going to be very important to do with some of our other evaluation tests as well. Now, another common means of identifying ligament stress or ligament injury is with certain types of joint stress tests that will stress that particular ligament and see if it reproduces pain or if there is joint instability associated with it. For example, here's an image of that valgus stress test, which is often used to identify damage to a medial collateral ligament. So what we're doing is applying gentle pressure on the outside of the knee, pressing inward to see if it reproduces discomfort or if there's a sense of kind of a mushy feeling to that ligament or if there's a joint instability associated with that. So these ligamentous stress tests will put stress on the ligament in the direction it's designed to resist, and that's an essential way to identify or get a better understanding of if we might have a ligament sprain that's present. So now let's talk a little bit about treatment. How do we go about treating these things? The first thing is to note, is this an acute injury or what is the level of severity of that injury? This is one of the reasons why assessment is so crucially important, is we have to determine, is this injury, at a severe state, a very recent state, in which case any of our treatments are going to be a lot less intense and more generalized in their approaches. If it's a little bit farther along in the treatment process, we may be a little bit more aggressive with our treatment and do a little bit more specific localized tissue work that's going to get a good result in those tissues that we're focusing on. So with either the sprains or the strains, we're going to give some good generalized treatment first to help encourage tissue mobility, tissue fluid movement, and find various different massage techniques that will decrease pain and will improve local circulation around that area and get that person back to activity. Usually this also may encourage gradual stretching and strengthening exercises, and massage work that's going to be a little bit more general first will gradually move into things that are going to be a little bit more specific, such as pressure and specificity and movement going along with the technique. So we might do some movements associated with the massage techniques that we're doing a little bit later in the treatment process. That won't be done necessarily right away. So earlier on, we've had a lot of discussions about the primary role of massage in addressing ligament sprains associated with what they're doing with scar tissue. And you may have heard that it's important to what we're doing with massage is trying to kind of break up scar tissue and get that tissue as mobile as possible. We now have a better understanding of the role of massage in relation to scar tissue, and we really aren't breaking it up. We're not breaking up or separating scar tissue, but what we're trying to do is to increase mobility of adjacent tissue so that they really get a chance to kind of slide and glide amongst each other as best as possible. Now, there's also some indication that massage techniques and some of the deep specific like deep transverse friction techniques might actually have some benefits in stimulating fibroblast activity around an injury site. So that could be another important method of what we're getting out of what we're doing here. Now, for the ligament sprains, the same is generally true. We're going to have generalized treatment first to try to help reduce associated muscle spasm, encourage tissue fluid movement, and really try to get that area as mobile as possible. Now, I want to make one point here about muscle tightness, because one of the things that we are often trying to do as massage therapists is reduce muscle tightness, with this idea of like, as much as we can reduce muscle tightness around an injury, that's a good idea. But sometimes the muscle tightness is actually a benefit. For example, after a ligament sprain, especially in the early stages, because muscle tightness really can help make up for the lost stability from the damaged ligaments. when those ligaments have lost their ability to stabilize the joint surfaces. Tightness or hypertonicity in muscles can help make up for that just a little bit. So that's an important factor to consider when we look at how severe is this injury, and do we really want to get that supporting muscle as loose as possible? Maybe not at that stage. Maybe help it a little bit, but let it do its job to help increase the stability around there a little bit. Now, also very important to identify is with both of these types of conditions, strains or sprains. While there are things that we can do with massage that will be helpful, sometimes it's also very important to refer these individuals onto another health professional who can more specifically identify and associate if there is more serious injury that, for example, might even need surgical intervention, especially in the case of like ligament sprains where there's significant joint instability in there. There may be a need for doing some other types of treatments that will be associated with it as well. So do remember, as we said earlier, also, it's important to make some distinctions between the acute and chronic status of these different injuries. The assessment is a crucially important part of identifying what stage they're in, what's going to be the most appropriate treatment to get the best and most beneficial results on there. So if you really want to learn how to help your clients with a wide variety of pain and injury complaints like the sprains and strains, come join us over at the Academy of Clinical Massage, where we dive deeply into learning about these kinds of conditions, all about assessment strategies, treatment strategies, clinical reasoning, kinesiology and biomechanics, pain science, numerous other factors that play a big role in you becoming the most effective and successful practitioner with your clients who might have a wide variety of pain and injury complaints and are looking for you to be able to help them. So see the link in the video description for more details over at the Academy of Clinical Massage. So remember, muscle strains typically involve pain when there's a contraction of that muscle or during manual resistance with active loads, palpation, and indications of something that might have caused a significant excessive tensile stress on the muscle or excessive load on it when it was under a contraction, either concentric or eccentric contraction. Ligament sprains are going to be much more likely to be occurring, pain is likely to be occurring around joint surfaces, especially if there's forces that would have caused a high force load to that particular joint that the ligament was trying to resist. As we said before, client history is crucially important in order to identify those different forces and the type of injury condition that that client has likely engaged in. So let us know if you found this helpful, and drop any questions that you have into the comment section, and let us know what other information you'd like to learn more about. We're happy to share as much of that as possible with you. Here, our goal is to help you become a much better practitioner and help people out there who are in dire need of your care for dealing with musculoskeletal pain and injury complaints. We'll see you in the next video.